Perfect. Well, thank you so much to everyone that has joined today. Today we'll be having the pleasure of hearing this webinar, or having this webinar with everyone today. It is called Interpreter Communication Protocol and Guidelines, which will be presented by Sabrina Morales, the CEO of Linguistica. So thank you so much to everyone. So I'd like to address some housekeeping items before we start. Again, I'd like to thank everyone that attended our last nationwide webinar, which was held in October. That webinar was HIPAA compliance for language services. We actually talked about HIPAA's privacy and security rules as they apply to language services, and we provided practical steps for compliance across healthcare settings. As a reminder, we wanted to let everyone know that our webinars are regularly held every fourth Tuesday of the month. I did want to point out that with Christmas coming up, we are going to have that webinar held on the third Tuesday. So it'll actually be on the 16th, not the 23rd. Wouldn't make sense to have it just a few days before Christmas. That webinar will actually be titled Community Engagement Strategies for Diverse Immigrant Populations, Building Trust and Improving Outreach Through Language Access. So in that session, we're actually going to explore how effective interpreter communication protocols serve as the foundation for clear, respectful, and accurate interactions across all languages. We're also going to be diving into proven strategies and practical approaches for working successfully with the interpreters and strengthening the trust in multilingual exchanges and ensuring that communication is both accurate and culturally responsive. So we're going to be looking into that topic next time. I did want to point out that um, we love hearing from everyone that attends these webinars. It's very important to us. And actually, some of the topics that we mention are actually brought about by our attendees, by our clients themselves, our partners. This would be one of them. We're actually holding the interpreter communication protocol and guidelines because of that, because of feedback that was provided to us. So just know that we have a host of topics lined up when it comes to language access, equity, and Title VI compliance. That being said, we're always open to knowing exactly what your guys' needs may be, what your guys' expectations might be. And when it comes to language access, we want to know about those items as well. So if you would feel comfortable, letting us know what one of those topics might be, I mean, we'd be more than happy to look into that for you. And hopefully we can have it as one of our sessions in the near future. So just definitely keep that in mind. I did want to point out a little bit more about today's speaker, and I realized that I failed to introduce myself. My name is Dan Tenorio. I'm a specialist here in the account management team, and I'm happy to be introducing Sabrina Morales today to this presentation. She is the CEO of Linguistic International, and she actually is not only a certified interpreter, but she's also a national trainer and a very trusted leader when it comes to equitable language access. She has had experience for over 23 years now, and she's had the privilege of working alongside local, state, and federal agencies, enabling and helping them create interpreter programs that have been both compliant and have been built to last. And Sabrina actually earned her MPA from the University of Utah and has also completed executive programs at both Stanford and Babson College. And on another note, just to be able to introduce today's topic more formally, um, the reason why we wanted to hold this is because it is important for all of us here in attendance to know what's the best way to get the interpreter experience. What's a way to get the best out of that when it comes to interpretation. And with the Interpretation Communication Protocol and Guidelines webinar, we wanted to take a chance to do that because there is a practical framework involved so that we can know how to better assist your guys' team, how to help your staff and service, provide communication clearly and effectively with interpreters, while also maintaining professional boundaries and ethical standards. We also want to take this moment in this webinar to explore how to establish clear pre-session and in-session communication protocols and just create an environment that fosters both neutrality and trust, and just ultimately making it for a great experience that, produces the outcome that you guys will be looking for as clients. And we want to make sure that it's a proper and adequate experience for our limited English speakers as well, which you guys know are the LEPs. And I also just wanted to take a moment. I know Sabrina will also mention this too, but for anyone in attendance that could find this beneficial for our services, actually, when it comes to over the phone service. And do keep in mind, we also provide not only over the phone interpretation, but video-based interpretation. We also provide document translation. We provide, in many instances, in-person translate interpretation as well. So I did want to just point out that for any person or partner of ours that, I understand that there could be periods of times where service is not needed as much. So I did just want to take a moment to just explain that with our services, we have a main number. We also have a toll-free number. But if you ever need to get a hold of us for services, if you just call a number, I'll make sure to add this in the chat box as well. If you call our number, which is 801-262-4550, that will be the main number to be able to get services with us. If you, for example, click 1, that will have you go to our over the phone menu, at which point it will ask you if you need service now or if you need to schedule it. By clicking 1, you will get on-demand over the phone services, and then it will ask you to provide some information in regards to your existing account with us. If for whatever reason you at this point in time did not have an existing account with us, just reach out to me. I'd be more than be happy to help you with that. But just know that that would be the initial way of getting service with us. And I will make sure to send out more information on that. If you guys ever needed to get a refresher on how to ask for services with Linguistic International, we'd be more than happy to send you a form about that. But with that being said, I want to make sure that I give now the time to Sabrina Morales, our CEO, so that she can give us this presentation on interpretation, communication protocol, and guidelines. Thank you, everyone.
Thank you so much, Dan. Welcome and good afternoon, everyone. Thank you so much for joining us today. As Dan mentioned, this presentation came out of a request from clients to understand how to meet compliance standards around interpreting services. We extended the presentation a little bit, and I will give you some statistics as well. And that's where I want to start today in terms of what the need is actually in the US. So we are serving one of the most linguistically diverse populations in the world, right? There are approximately 25.7 million US residents that are limited English proficient in the US. And among them, and especially among the adults, nearly half of the adults in that group fall into the category of being limited English proficient. Now we'll see in some of the further slides that the majority of the languages tend to be, the ones that we have listed here. Spanish, that's Chinese, Cantonese, and Mandarin is included on there. Vietnamese, Arabic, and Tagalog. However, the most common LEP languages, while those are the ones that are listed, there are many, many dialects and hundreds of other languages that are spoken nationwide. Even within one single language, I'm sure some of you may know this, there are regionalisms that require an interpreter to be from a specific area to really be understood by that speaker. So we can mention Arabic as an example of that, Arabic having so many multiple regional forms, right? It's really important that our agencies, when they're interacting daily with individuals, it may struggle from fully understanding the complex US systems, that we have interpreters are available, but the interpreters aren't necessarily just an optional service, but it's really a way to maintain public safety and to ensure that we're legally compliant. Now, how do we make the transition of helping LEP communities in the best way possible? I know that many of you have used internal staff that know how to speak different languages. It's very important that they all receive training on how to interpret, because there are some standards that we as interpreters need to follow in terms of accuracy and in terms of clarifying certain things. We want to make sure that we never ask family members or friends to interpret, because not only are we putting the LEP individuals at risk for lack of neutrality or confidentiality issues, we want to make sure that everything that we are interpreting is correct and accurate. So today, about 47.8 million immigrants live in the United States, and they are not just concentrated in one region. We have immigrant families now living pretty much everywhere, right? From small rural towns to everywhere in between, really. The key point is that LEP individuals are pretty much embedded in every aspect of our community. The type of clients that we serve on a daily basis range from schools to clinics, to community organizations, obviously public benefit agencies, and they require the service in a way where not only will they understand what they're receiving there, but they can also follow instructions on how to complete processes afterwards. The training that we had last month that focused on HIPAA, we talked about how HIPAA just revised its regulations in June of this year. And the majority of the changes that we saw have to do with issues around technology and how we share information. One of the big questions that we have being asked by clients today is, how do we share information with clients that don't speak English, translated forms, things of that nature? How do we include essentially, everyone within the new HIPAA requirements? If you haven't watched that training, you can feel free to do so. If you go to our website, you can access the training. We have all the webinars listed on there and you can watch it. Important things when it comes to communicating with LEP individuals through technology, and how you do so using the correct and proper methods and translated text. I want to quickly talk about refugee resettlement. So for those of you who work with refugees, and the majority of government agencies do, the groups are increasing significantly. In 2024, the US admitted over 100,000 refugees, and that is the highest that we've seen in 3 decades. We work with refugee resettlement agencies, and through the work that we do, we are very aware of the different groups that are coming in that are needing different services. The cap for 2025 is 125,000 new refugees. If you live in a refugee resettlement state, I'm sure that you're encountering some of these, I'm going to call them less common, or in our industry, they're called languages of lesser diffusion, meaning languages that are rare. So we see Dari, Pashto, Somali, Rohingya, Kinyarwanda, Burmese, Ukrainian. And if you have encountered these languages, it's very likely that your state is a refugee resettlement state. Now, these communities do need immediate access to health screenings and school enrollment, things like that. But because they're coming into the US as refugees, they're already allowed or permitted a certain level of benefits and case management that goes with it. Government agencies do play obviously a vital role in making sure that these communities are getting resettled appropriately and that they have all the services necessary. Sometimes when new refugees are coming in, those languages of lesser diffusion create problems because the organizations are already familiar with serving Spanish speakers, but then when they start seeing the Ukrainian community, then it becomes an issue of scrambling at the last minute, trying to see who they're going to access for language services. Now, a lot of times, for those of you who don't know, Linguistica is a government contractor only. I know that with government agencies, there are so many staff members, and there's currently a lot of turnover in every industry, really. So what we are suggesting that you do to ensure that Title VI compliance is always at the core of your protocols is that you make sure that you are listing the phone number for language access, or even better, which a lot of our call centers that access our services do, they add our phone number to their automated systems and ensure that new staff members know how to access the services. I can't tell you how many times we've seen staff members scrambling at the last moment that they need an interpreter, but they don't have an account, or they don't know how to use the service because they haven't been properly trained. Now, whether you use Linguistica or any other language service, you want to make sure that your staff members are aware of the steps and what mode of interpretation they're going to use. So we'll talk a little bit more about that. Dan mentioned that we provide over the phone, video, remote interpreting, and in person. And so you want to make sure that you're aware of when to use what type of service. On this slide, you'll see an overview of the major languages spoken by people with limited English proficiency. But the key takeaway here, because you see Spanish, and that's about, 62% of the LEP community in the US that speaks Spanish. But the other category is actually quite significant. And you will find languages like Burmese, Karen, you're going to see all the languages of lesser diffusion in that category, including dozens of very rare and emerging refugee origin languages. And they may be encountered at your agencies for the very first time when they come in as refugees. So you don't want to only assume, that if you have the 5 top languages covered, that you're okay. You really want to make sure that you understand your communities. As I've worked with different clients throughout the years, one of the most important things that you can do is evaluate what community you're serving. Many of us have data already within our organization. I can tell you we've been tracking client usage for 20 plus years. And these are reports that we can send you if your agency has been using us for a while. We can send you usage reports and you can see your language trends. Some of these reports aren't necessarily accessible. They're not accessible through the portal unless you ask us for this information, but it's really critical for your agency to know what languages are being accessed and the language trends as they move and change over time. So even though Spanish is the largest single group nationwide, as you can see from this chart, the language access strategy that you have to build must be broader, right? And understanding the linguistic diversity in your community is really important for you to be able to be prepared on what languages you will see and the translated documents that you would benefit from having. Now, we've done a number of webinars on legal framework. So this is kind of a frustrating slide for me because it's a very quick slide that summarizes what are the legal requirements around language access. But we've created full webinars on each of these bullet points. Title VI is the most important piece of legislation that you should be aware of in terms of protecting language access. And that is Title VI of the 1964 Civil Rights Act. It prohibits national origin discrimination, and language access is defined under that. So that's essentially the law that protects language access within any government agency, including quasi-government agencies like nonprofits that receive federal or state funding. And we have Executive Order 13166. Now, there's a lot to say about this. This executive order was created in the year 2000 by President Bill Clinton. It has been revoked as of March of this year. However, the reason why I wanted to mention it is because Executive Order 13166 laid the framework for all of these, for the majority of state agency work that's happened around language access. It required federal agencies to improve access for LEP, but that went above and beyond the reasonable access. It provided it had requirements around translation of documents, training for interpreters, training for in-house staff that knew how to speak different languages, essentially creating them as dual role interpreters. So again, because Executive Order 13166 has been revoked, the reason why I wanted to mention it was because it still created a lot of the framework that we still have in place today. Then we have Section 1557 of the Affordable Care Act. And this particular rule extends civil rights protections in health programs, and it reinforces language access and obligations. And then the last two are more guidances. The national class standards is this last bullet point here. We actually did do a webinar on this. I think it is an amazing document. It's 15 standards that you follow step by step to create culturally and linguistically appropriate services within your organizations. This set of standards was created by Health and Human Services at the federal level. You can download this document. You can email me and I can send it to you. We have information on all of these legal protections for language access. So if you want to email me, I can certainly send them to you. You can also just Google them and find them. There are additional legal frameworks that are specific to your state. So let's say you're in Delaware or in Michigan or in Tennessee, wherever you may be, there are some states that require additional language access within certain programs. And we have done webinars that are specific to certain states. The last one that we did was on Tennessee. However, the states with the highest language access protections tend to be California, New York, Texas, Washington. But be aware that at the state level, there are also rules around language access. Let's go ahead and skip this slide. I want to talk specifically about pre-session protocols. So I'm sure many of you have worked with interpreters in the past. The majority of what I'm going to discuss now has to do with how to work with interpreters effectively. So a pre-session is the most effective thing that you can do. Sometimes we ask our interpreters to do pre-sessions when, not sometimes, I'm sorry, all in-person interpreters are required to do pre-sessions. However, you as the provider, and I'm not just talking medical provider, but you as the individual that's working with the interpreter should also be doing a pre-session because it will help you in the long run really understand what, really basically set the ground rules for working with interpreters effectively. What you want to do primarily is before you start the interpreter encounter, you want to take a few seconds, I'd say a minute or two, to do a quick pre-session. So these are just tiny steps that make everything smoother. You want to confirm the language and the dialect and share your goal for the session. So you can say something like, this is an intake, or we're going to be reviewing a form today. So you want to set the expectations. Then you want to make sure that you speak in short sentences because there's this idea that I've seen over and over again where clients speak very fast and give a lot of information and they think that that's going to speed up the interpretation. That will not speed up the interpretation. In fact, what will probably happen is the interpreter will stop you and ask you to repeat yourself or ask for clarification. Know that interpreters are not there to summarize your session. So it's really important that by really focusing in and honing in on the most important topics, that you speak in short sentences to allow them to interpret everything. There's two modes of interpretation. There's simultaneous and consecutive. Simultaneous is what interpreters do when they are interpreting at the same time that I'm speaking. And consecutive is the type of interpretation that we do 99% of the time. And that has to do with you say something, and then the interpreter interprets, and then the client, the LEP speaks, and then the interpreter interprets that, right? So consecutive interpreting, no matter how fast you want to make it, you can't go faster than than what is required to say one sentence in one language to another sentence in another. So you need to make sure that if you want the session to be fast, you speak in short sentences and you hone into the message. The pre-session will actually help you to understand that it will help the interpreter understand and will help the LEP understand that there's a sequence that you want to follow. By setting these ground rules, you can actually experience a faster session. Now, another thing that we see frequently is when the client speaks to the interpreter instead of speaking to the LEP. So let's say I'm a medical provider and I'm speaking to Maria. I will say to the interpreter, can you please ask Maria, if she took the medication? By not speaking to Maria directly, you're making the session longer. So you want to speak to her directly, and the interpreter will also interpret in first person. Now, the interpreters are trained to do this, but the clients are not. So oftentimes the interpreter can actually model what you're doing, and the client will quickly catch on. If not, they can also do a pre-session with the LEP individual, and things will tend to go faster and smoother. When it comes to protocols, you want to confirm and document things always, okay? So the summary of this particular slide is by introducing yourself to the interpreter and introducing yourself to the client, by allowing the interpreter to know what it is that you're going to be doing in the session, things will tend to be smoother and faster. And always remember to speak directly to the individual, not to the interpreter. So during the session, you want to look directly at the client. That's if you're doing video remote or if you're doing in person, right? You want to speak to the individual as if you were sharing the same language, essentially. You want to keep your sentences short. You want to avoid any metaphor or slang. Sometimes jokes don't interpret correctly either. So just keep it, simple, I would say. You want to watch the client's facial expressions if you can, if the session is in person or through video. As interpreters, we are assessing whether or not the client is understanding, but remember that there's only so much we can do, right? Because we are your words. We are communicating on behalf of you and on behalf of the individual. However, there is a lot that you can do to ensure that your LEP clients are understanding the session. One thing that I suggest is you can actually ask the client, let's say that you're giving them instructions on how to apply for Medicaid or for, I don't know, SNAP, or for any kind of eligibility of services, and they have steps that they need to take. You want to, at the end of the session, ask, let's call the LEP client Maria. Maria, can you please tell me, can you please repeat to me what steps you're going to take? What did I just tell you? What steps do you need to take? Now, this is obviously if you have time. We can assure you that the interpreters are doing the best at interpreting the message, but sometimes LEP clients get lost in the interpretation. And so by asking them to tell you, or to do a teach back is what it's called, to teach back or to tell you what you said, you can confirm that they did understand the message completely. Part of the protocol, again, is this whole issue of documenting interpreter name, language, modality, and I'll talk to you about that here in this next slide. So after the session, you do want to take a moment to wrap up professionally. So again, the teach back is really critical. If you can do it, I suggest you do it. You want to do a quick debriefing with the interpreter. Sometimes it's necessary, sometimes it's not. I'm going to say it's more important for meetings like IEP meetings at schools and things like that, or administrative hearings. If it's a simple conversation, I don't necessarily think that the interpreter debriefing is necessary. However, you do want to document that you use an interpreter. 99% of our clients are government agencies, so rest assured that we know these processes very well and that we can help you in whatever you need in terms of documentation. But On your end, you should be documenting that you used an interpreter, what language you used. You should be documenting the modality you use them in, and the language and dialect. If I don't know if I said that already, but you should also document the written materials that were used, if there was any that were site translated. If you're in the medical field and you're using Epic, for example, which is one of the most highly used medical record management systems, right? If you scroll at the bottom, you will see that it requires for every check-in with a patient that the interpreter sign their name, their language, and the interpreter ID. This is a best practice model that's followed in the healthcare industry, and now government agencies are also using this model. Why? Because you want to make sure that if you're going to communicate with this person in the future, you already know that they speak Ukrainian and that they are used XYZ interpreter, right? You also want to make sure that if there's any HIPAA audit, that you're complying with all the Title VI requirements. So that's one of the biggest and most important tools that you want to have in terms of just I guess checking the boxes of compliance. So what modality should you be using? There's in person, there's video, and there's over the phone. Now, we did do several webinars ago. We discussed in-person shortages. After the pandemic, in-person interpreters have become very difficult to come by. The interpreting world is experiencing a shortage of in-person interpreters. It doesn't mean that there are no interpreters available for in-person. It just means that you have to plan ahead of time. Okay, and if you are going to use an in-person interpreter, because let's say it's a breastfeeding class at a WIC clinic, for example, you want to make sure that you do it ahead of time and that you let us know with enough advance notice what if you have a gender specific interpreter that you need, right? If you are going to be using video remote interpreting, I suggest you, if you can, create a video remote room within your office or an area that you're going to designate as a VRI room. The reason why I say this is because I can't tell you how many times clients are scrambling at the very last moment because the camera won't turn on or there's technical issues that are happening on their end. It's really important that if you are any kind of preparation that you can have ahead of time so that your staff members know where to go, what to do to use the VRI system. We can always, I know Dan mentioned this at the beginning, if you need a refresher on how to use a certain service, we can certainly participate in any of your staff meetings and show you. Any interpreting agency that's providing services to you should be able to do this as well. You just want to make sure that you're prepared and that you're ready to access the service when you need it. Over the phone interpreting is used for fast, brief interactions, although many times over the phone, because it's the easiest way to access an interpreter, it's used for pretty much everything. As a former interpreter myself, I would say really the only drawback in over the phone interpreting is we can't assess whether or not the LEP individual maybe made a facial expression that they weren't understanding the message that you're trying to relate to them. So you do have to sometimes ask them for teach backs if necessary, if you're giving them instructions. Other than that, over the phone, I think is really the fastest and most cost-effective way, right, to provide the service and to quickly access an interpreter. So this little slide, this is some suggestions that I think are really important for when you're using an interpreter. A few of the do's, right, that we've already mentioned. You want to speak to the client directly. You want to speak to them in first person and in short segments. You want to use low register or languages that are not too complicated. Many times, especially in the medical field or the legal fields, right, we have terms that we can't simplify because that's just the name of the condition, or that's just a word that needs to be used, and that's fine. But if you can make things simple, it helps everyone in the session. You want to clarify terms If you're using program names, make sure that the interpreter is aware that it is a program name. For example, we have organizations that we serve in Michigan, for example. I believe the is it the 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 program that they use to call for unemployment. I can't remember what the name of it is, but it sounds like a name of a person. And when you're interpreting, if you hear the name, I'm just going to use the word Marty, for example, right? If you hear the word Marty, you think that it could be someone's name. So you just want to make sure that if you're using a program name, oh, there's one in Washington called Apple Health. That's a good example, Apple Health. So you just want to make sure that the person knows, that the interpreter knows that that's a program name and that you're not referring to an apple in that case, right? You want to pause and check for understanding if necessary. The teachback is really critical for that. And you want to maintain professional boundaries, which, I'm sure that's just a common rule with any language. It's better if you don't say tell her to, or if you speak directly to the interpreter. It just adds words. It creates a longer session, creates a little bit of confusion. Again, you don't want to speak in long monologues or, ask the interpreter, summarize this, and you talk to them for 5 minutes. Interpreters are not there to summarize, and you don't want them to pick and choose what they say. You want to tell them exactly what you want them to say. You don't want to rush through the session. If you have limited amount of time, a 15-minute appointment with a medical provider, for example, just go in with the idea that you already know that this session is, you're going to be using an interpreter. So try to keep it focused on the topic. And really that's the best we can do. All of the interpreters are going to be as quick as possible, but there's some things that you just can't rush. You're going to, some of the examples that I want to share with you here are, in the case of speaking with them directly, you're speaking, in this case, in the medical example, what symptoms are you experiencing, instead of saying, can you ask her how she's feeling, right? I think these are just some basic little rules that would benefit everyone. Let's talk about ethics and neutrality. So interpreters have to remain neutral and they cannot give advice. That's one of the main reasons why we never want to use family members or friends, because when we use family members or friends to interpret, you can bet that they're giving advice and not necessarily keeping it neutral, right? That's their family member or friend. They're going to say whatever they want, and you want to make sure that you are keeping things professional. If a client asks the interpreters for guidance, I can't tell you how many times this happened to me when I was an interpreter. The clients will ask the interpreter for advice. This happens less on video or over the phone. It happens more in in-person interpretations, but interpreters know that if you are interpreting in person and you're asked for advice, that you have to redirect the question back to you as the client. If the provider ever asked an interpreter, so if you ever asked one of the interpreters to change a message or to soften a message or to summarize a message, just know that that's not something that we can do. We have to remain accurate at all times. If a family member insists on interpreting, and this happens quite frequently, where they're going to refuse the interpreter, they're going to say, no, I can interpret for my mom, or I can interpret for my son. Know that you should be documenting this, because you're required to offer a qualified interpreter. And if you were to be audited, or if anything were to be to happen, you need to have proof that you actually requested or you were going to request an interpreter and the client refused. I had a really difficult situation a few years ago where one of our clients called us, and they had a situation where there was a, a son and his father. They were going to a medical appointment. The son refused the interpreter and decided that they would not tell the father that he had been diagnosed with cancer. And so the patient was going to the hospital to receive cancer treatment, and they hadn't been told that they had cancer, because the entire time the son was denying the father from the full communication that was happening between the doctor and him. It happened with a rare language. So I think that if it would have happened maybe with a more common language, it would have been caught earlier on. But, there's a number of horror stories when it comes to having minors or family members interpret. Using children or family members is generally not allowed even in protocols within your organizations, but there's also states that have passed laws around using children for interpreters that are quite stringent with those rules. Only in very rare or true emergencies could that happen temporarily, and that needs to also be documented. A simple script that you can use if a family member or friend wants to interpret is you can say something like, I understand that you'd like your family member to help, but for accuracy and for your privacy, we're required to use a qualified interpreter, and then make sure that you document it. So I mentioned at the beginning of our session that HIPAA changed. It's the largest change that we've seen in 10 years. It modified, a few of the HIPAA rules were modified in June of this year, and they all focused on technology. So if you want to go back and check out that webinar, or if you want to do a little research yourself on how that affects your compliance, the HIPAA within your organization, I suggest you do that because there were some significant changes there. But when you're using video or phone interpreting, make sure that you're setting yourself up for success. Check your camera, check your lighting, check your internet connection. Use headsets when you can to improve the sound quality. Make sure that you are still focused on privacy. So you want to avoid hallways or waiting rooms. You want to avoid speaker phones, as much as you can, unless you're in a room where you can close the door. And you want to eliminate background noise as well. So again, my suggestion for video remote interpreting is if you can designate an area within your organization for VRI, I think that's the best idea. Over the phone or OPI, just make sure that it's always in a confidential area. Business associate agreements are always signed with providers of language services. So know that your information with Linguistica is completely private, and that we are bound by HIPAA to also keep all of your information private and make sure that none of it is shared. We also have to abide by HIPAA as your business associate. There's a few concrete scripts that I wanted to share with you here. Obviously, it's really up to you how, and it depends what type of services you're offering, and you can modify these as necessary. But when you're using an interpreter, you could have a pre-session in place, something like, hello, my name's Sabrina. I'm the case manager here at the Department of Workforce Services. I'll be using an interpreter today, and we're going to speak in short sentences, and I'll speak to you directly, or I'll speak to you in first person. You also want to mention that everything is going to remain confidential. And you also want to mention that you might need to pause to ask for clarification. And again, only if necessary, you can also mention that you need for them to repeat to you the instructions that you gave them. For the closing, you can say, these are your next steps. Do you have any questions before we finish? Excuse me. Okay. The department procedures really depend on what agency you're with. You can be at a vocational rehab, you can be at we serve, again, anyone from government uses us, and we have 32 different states that use us across the US. They all have their own processes in place, but the ones that use, or the ones that outreach to, I'm not even going to say outreach, the ones that are most effective at serving LEP communities typically follow certain standards, and the standards are the class standards. And those class standards, the cultural and linguistically appropriate services, talk about these particular things. So they're very basic, but they make a huge difference. One, you want to have signage. You want to have signs that have language assistance is free here. I'm sure you've seen those in hospitals and different organizations. We can provide you with posters. We can provide you with language cards. So if you do need them, feel free to contact us and we'll send them to you. Some organizations make their own. The point is that you want to have I Speak card or language assistants or free posters at the entrance of your main reception areas. You also want to make sure that you have a way to access over the phone or video remote interpreting always, and that you have an escalation tree for those things. If your organization's open 24/7, we are too, because we service emergency dispatch centers. So know that we are available 365 days a year, 24/7. But you want to make sure that your staff members have the phone number and their account number, or they're going to be scrambling, when they call. So make sure that we can also send you little postcards that have the contact information and your account number if you need to. You want to make sure that you can add the documentation. So if you have forms already that your customers or clients are filling out, make sure to remember to add a section on, did I use an interpreter? What language was it? What mode did I use? This is going to be part of your audit requirements and fulfilling the Title VI requirements. And you can do a lot of other things. We have data of all the languages that you've used over, the past few years or however long you've been using it. If you have been a client of ours for a long time, and if you want a language access report, we can certainly send it to you. We also have data on refugee resettlement states and what languages you will be seeing if there are new refugee groups resettling in your area. So we can certainly provide that feedback to you, and we would love to do so. We really see ourselves as a strategic partner in helping you be able to serve your LEP community in the most effective way. And honestly, I feel like everyone in Linguistica is so passionate about this. It's not necessarily about just using Linguistica. It's about, if you are seeing large numbers of Vietnamese community members at your facility, for example, you can also hire Vietnamese community members to work in your organizations, right? You want to make sure that you're creating an environment that's welcoming to the communities around you. And it's almost like, if you build it, they will come. We have seen this many, many times. In fact, there was a local clinic here in Utah, our headquarters are in Utah, that started using our services for interpretation. And they said, oh, we don't have a lot of people that speak different languages in our community. I kid you not, once they started offering interpreting services, so many people came. Then they ended up hiring, I can't remember what language the receptionist spoke. I think it was like Mandarin or something. They hired a Mandarin speaker in the front desk, and that community started going there as well. So oftentimes it's just about opening the doors to have everyone feel welcome in that organization, and they will come. Several different case studies here that I wanted to mention just very briefly about how people use us in different areas, right? So a setting can be a public benefits office. The challenge is here, there are a lot of eligibility terms. By the way, if you have forms that you frequently use that you want our interpreters to be aware of, you can send us information about your organization and we will share that information with our interpreters. We have interpreter trainings. We have about 17,000 contractors that we work with, and a lot of the languages that we provide services for frequently, they participate in different trainings and they receive training on terminology specific to your organization. So if there are complex terms that you use that you want the interpreters to know of, provide us that information and we will love to give that training to our interpreters. So here they're just talking about, one of the best practices would be using over the phone interpreting, creating glossaries around those terms. We've helped clients create glossaries before. It just keeps everything very standardized. And it's nice for you to have it in multiple languages as well, because that way you're just not interpreting or translating, I should say, one language in multiple ways. You have a standard translated glossary of your terms. For school IEP meetings, that I'm sure not this isn't applicable for everyone, but again, in these kind of meetings, there's multiple speakers, and anytime you have a lot of speakers, you want to make sure that the interpreter is not only aware of what's going to be happening, but also that they are aware if there's protocols that need to be followed. So you want to provide us with the documents in advance, and that can be very helpful. In a community clinic, there can be a lot of sensitive history being shared. Again, just keeping everything confidential and making sure that you are, if you have a gender specific appointment, that you give us enough advance notice so that we're able to accommodate that. If you have a regional specific request, for example, if you just say, I need an Arabic interpreter, if you have more information, let's say the person is from Egypt, then you need an Arabic speaker from Egypt. That's going to change the dynamic, because some Arabic countries don't understand each other just because the regionalisms are so significant. So the more information you have about what language the client speaks or the LEP person speaks, the better. Continuous improvement is obviously really critical in this area. We find that getting feedback about the services is essential. If you're going to call us to provide any kind of feedback to us about our interpreters, we obviously need to know the time, the date of the call, the language. If you want to gather feedback from your limited English speakers about your services, you should be translating surveys, because otherwise you're only getting result English speaking clients, right? So a lot of the continuous improvement is just thinking, okay, if I were a refugee and I came into one of your facilities, how easy would it be for me to get services? Think in terms of access. How easy are the services that I am providing? How easily accessible are they for somebody that doesn't speak English? How do I communicate back to them? How can I create a plan that incorporates everyone in my community, and how can I measure its effectiveness? So all of those things are worth thinking about, and I've seen tremendous success in different organizations. One organization that I worked with was Shriners Hospital, and they implemented such an effective program. It was really, really incredible. They trained all of their internal staff members that spoke different languages. They trained them all how to interpret. They added the phone number for Linguistica in their automated system, so that when they didn't have an interpreter in-house, they could call us quickly. They added posters on language needs. They started a feedback or surveys from the families that were coming in that didn't speak different languages. All of these things really helped. And then this last bullet point here, staff refreshers. We can always come in and give a training. You can always download the webinars. All of our clients know that we want to be a strategic partner to them and provide them with as much info as possible on the communities that they're serving. So if you ever have even, a small group that you're going to be meeting with, and you want a refresher, we can certainly come in and do that. I would download this document or email me and I can send it to you. Again, even though it's an older document, it's still very, very relevant. And this is the standard, the gold standard to providing services in your government agencies. It's called the National Class Standards. Again, it was developed by the U.S. Health and Human Services. There's a lot of other information that you can also get that's, I think, really relevant and important. The American Community Census info, I think that's the most up to date when it comes to LEP communities. The last one is the 2022 one, but that's where you see trends in language and trends in immigrant and refugee communities within the rural communities as well. So that's a really amazing resource. This is my contact information. Dan and Jordan are in the account management department. You can also reach out to them. It's been a pleasure speaking with you today and sharing with you all of this information that we are so passionate about. And I hope it helped. I hope that you were able to learn a little bit about the protocols that are best practices throughout the US on language access. Thank you so much for your time.
Thank you so much, everyone, for having attended. Thank you so much, Sabrina, for that great presentation. I know that everyone in attendance will now reflect on what are some things that are currently being practiced, what are some things that they want to implement as far as the interpreter protocol, interpreter guidelines, and etiquette when we do service language services for you guys. I also wanted to take this moment to just remind everyone, like we had talked about before, if at any point in time you have any suggestion, anything that comes to your mind when it comes to language services, language access, please be aware that we'd be more than happy to hear your guys' feedback, hear your guys' thoughts. We'd love to be able to know what it is that you guys are thinking about, what are some needs that you guys may have, so we can also take that into account and in mind for any possible future presentation that we provide. And again, like Sabrina had mentioned, and I had mentioned as well, we'd love to be able to hear from you guys after this presentation. If you guys would like to have refresher material when it comes to knowing how to start off by knowing how to request services with us, how to navigate our IVR or our phone system, how to go about with the in-person and video-based requests. Also, when it comes to document translation, if that's something that you may need or not. So just something to keep in mind. Feel free to reach out to myself and Jordan about that. Those are our emails. My email is dan@linguisticinternational.com. Jordan, our account manager, his email is jordan@linguisticinternational.com. So feel free to reach out to us. We'd love to be able to hear you. So if anyone would like to mention anything that they have as far as any questions or feedback, you're also welcome to do so right now in the chat. And if not, we'd love to be able to hear from you guys via email. And thank you again for having joined our webinar. Thank you so much. We appreciate it.